Some antibiotic note cards. These are designed to be used as note cards, but can also be used auditorily as note cards. Tetracyclines. Let's talk about the action and the route. Tetracyclines action. Inhibit protein synthesis. It's broad spectrum. Fights both gram-positive and gram-negative bacteria. Can fight Helicobacter pylori. Treats acne, oral and topical. There's some bacterial resistance that occurs, as with all antibiotics. The route is oral, IM, or IV. Tetracyclines, side effects and adverse reactions. Tetracyclines, side effects and adverse reactions can include photosensitivity, discoloration of permanent teeth, do not give to children younger than 8 years, stomatitis, GI distress, pseudomembranous colitis, blood dyscrasia, superinfection, CNS toxicity, hepatotoxicity, and nephrotoxicity in high doses. List some tetracyclines, short, intermediate, and long-acting. Tetracyclines, short-acting, tetracycline sumicin, intermediate-acting, dimeclocycline, declomycin, and long-acting, doxycycline, which is also called vibramycin, and minocycline, which is called minicin. Minicin is used for acne in children. Not young children under 8 years old, of course, but in adolescents. Tetracyclines include drug-food interactions. Drug-food interactions includes the interaction with milk products and antacids, decrease the effectiveness of oral contraceptives, and digoxin absorption is increased, leading to possible digoxin toxicity if it is taken with tetracyclines. Tetracyclines, nursing interventions. Nursing interventions for tetracyclines. Check CNS before the drug, so that's culture and sensitivity. Administer 1 hour before or 2 hours after a meal. Monitor kidney and liver function. Store out of light and extreme heat. Advise the patient to use sunscreen. Teach the patient to report superinfection. Warn the patient to avoid milk, iron, and antacids within a couple of hours of taking this medication. Tell the patient to use effective oral hygiene. Aminoglycosides. Actions of aminoglycosides and drugs. List some. Actions of aminoglycosides include inhibition of bacterial protein synthesis. So they're good for gram-negative E. coli and Proteus pseudomonas. These are both common UTI type things. Bactericidal, so they're bacterial killers. Amikacin, gentamicin, kanamycin, neomycin, streptomycin, tobramycin. These things are all aminoglycosides. Aminoglycosides, side effects and adverse reactions. Side effects and adverse reactions of aminoglycosides include photosensitivity, superinfection, ototoxicity, nephrotoxicity. The ototoxicity, be ever so careful if these are given IV so that they aren't given too fast. Make sure the pumps are working correctly. Go back and check your pumps after you've started them. Drug interactions, penicillins decrease aminoglycoside effectiveness. That's kind of one of those wild things. And there are interactions with Coumadin. Just like almost every antibiotic will have a reaction with blood thinners. Aminoglycosides, nursing interventions. Check culture and sensitivity. Monitor renal function and hearing loss, or for renal function and for hearing loss. Warn the patient to use sunscreen. Monitor for superinfection. Monitor peak and trough levels. Macrolides, side effects and adverse reactions. List some. Macrolides. Side effects and adverse reactions include tinnitus, ototoxicity, GI distress, superinfection, hepatotoxicity. Examples are erythromycin or emycin, clarithromycin or Biaxin, or azithromycin or Zithromax. You probably have had a Z-Pak before. This is a macrolide. What are some important nursing interventions for macrolides? Check culture and sensitivity before starting. Monitor liver enzymes. Advise the patient to take the full regimen until it's all gone. Administer antacids 2 hours before or 2 hours after. Give zithromycin 1 hour before or 2 hours after meals with a full glass of water. So that is your Z-Pak. Drug interactions for macrolides. Macrolides can cause levels of warfarin, theophylline, and carbamazepine to increase. Erythromycin levels increase with fluconazole, diflucan, ketoconazole. And with those increased levels of erythromycin, there is a risk of sudden cardiac death. Azithromycin levels may be reduced by antacids, especially if you don't wait that 2 before, 2 after. Macrolides uses. Moderate to severe infections are what they're used on. Respiratory and GI tracts, skin and soft tissue, sexually transmitted infections, pneumonia, bronchitis. They're used for people who are allergic to penicillin when it comes to strep. They're used to treat Legionnaire's disease. The one that's famous for that is erythromycin. Glycopeptides. What are they used on? So glycopeptides are things like vancomycin. Resistant enterococci will use glycopeptides on, and MRSA, the methicillin-resistant Staphylococcus aureus, will use it on also. So telavancomycin and vancomycin are in the glycopeptides. Vancomycin has some strong side effects. Redneck or Renman syndrome can occur when it's given too rapidly. There can also be severe hypotension, blotching of the face, neck, chest, extremities. It's a toxic reaction rather than an allergic reaction. Ototoxicity, nephrotoxicity, blood dyscrasias can all occur. Stevens-Johnson syndrome, which is a systemic inflammation. You'll see it in the skin, and it'll need to be treated with steroids, can occur. It is a vesicant, and if it extravasates, can cause significant damage. If there's pain with administration, assess the site. It's much better to give vancomycin in a central line if possible. Nursing interventions with vancomycin include checking culture and sensitivity before therapy, monitor vancomycin levels, the peaks and troughs, administer over 1 to 2 hours IV. Remember, you don't want to give it too fast. Rotate sites. Extravasation is a huge issue. Monitor for that. Monitor blood pressure, the site, renal function tests and hearing, and monitor for superinfection. The fluoroquinolones, 2 famous ones, and what are they used for? Fluoroquinolones. The action of fluoroquinolones is that they interfere with the enzyme DNA gyrase. They fight gram-positive and gram-negative bacteria. They're broad spectrum, and they're bactericidal actually. So Cipro and Norixin are kind of the famous ones. Cipro is used in urinary tract infections. It's used with Flagyl against C. diff. It's used in all sorts of things, pneumonia. And so these ones run the risk. So there's more famous ones, like levofloxacin, which is used on community-acquired pneumonia, chronic bronchitis, sinusitis. Avelox is also used too. Fluoroquinolones, some drug interactions and nursing interventions. So these ones, just want to let you know, they're very famous for causing inflammation in the tendons, so tendonitis, and then even tendon rupture. And for some reason, these ones like to rupture the Achilles tendons. Antacids decrease absorption rate. Levofloxacin increases the effectiveness of oral hypoglycemics. So you might see some low blood sugars in people on oral hypoglycemics. Increases the effects of theophylline and caffeine. Check culture and sensitivity. Infuse over 60 to 90 minutes. Increase fluid intake to more than 2,000 mils per day, provided their baseline allows for that. Tell the patient to avoid caffeine. Check for superinfection. Teach the patient to avoid excessive exercise, as tendon rupture can occur without exercise, but it's a risk with all fluoroquinolones. Don't eat yogurt at the same time as these. You know, same with the 2 hour before, 2 hour after rule, because it's got that calcium in it. Makes one very sensitive to the sun, so definitely wear sunblock. It's inactivated by minerals. Don't take with minerals. Your iron, your calcium, your zinc, those kinds of things. Sulfonamides. Sulfonamides inhibit bacterial synthesis of folic acid. They are bacteriostatic. They fight gram-negatives like Proteus, Klebsiella, and Chlamydia, and some E. coli. Their uses are on otitis media and respiratory infections, UTIs, prostatitis, gonorrhea, alternative therapy for patients allergic to penicillin. Oral, IV, topical, and ophthalmic routes can be used. Bactrim, what is it? Bactrim is trimethoprim sulfamethoxazole. We get a synergistic effect from these. It can be used on a lot of things. And then we can also decrease bacterial resistance. We can also use it in pneumocystic carinii as well as respiratory tract infections, otitis media, prostatitis, gonorrhea, and urinary tract infections. Side effects and adverse reactions to sulfonamides. Trimethoprim and sulfamethoxazole have side effects and adverse reactions which include moderate rashes, anorexia, nausea, vomiting, diarrhea, stomatitis, crystalluria, and photosensitivity. Sounds pleasant. Agranulocytosis and aplastic anemia, allergic myocarditis. Sulfonamides, topical and ophthalmic. Topical use of sulfonamides can cause hypersensitivity reactions. Thus, they are not frequently used. Sulfamylon prevents sepsis in cases of second and third degree burns. Silver sulfadiazine or silfadine can be also used in the treatment of burns. Ophthalmic sulfonamides are used to treat conjunctivitis and corneal ulcers. And again, when we're giving those, we want to put that into that lower lid, the pink area, into the conjunctiva. Nursing interventions for Bactrim. Administer with a full glass of water 1 hour before or 2 hours after meals. Increase fluid intake. Monitor for sore throat, bruising, bleeding. Monitor CBC. Check for superinfection. And advise patient not to take with antacid. And avoid direct sunlight. Then we get to the final one, which we call an oddball. This is metronidazole or Flagyl. Flagyl is used for Giardia and Clostridium difficile. It can kill microorganisms with flagellar structures. Don't take this with alcohol because a disulfiram reaction can happen, and its effectiveness is also decreased with alcohol. So the effectiveness of the alcohol gets increased while the effectiveness of flagyl is decreased. It's used in combination with other drugs like Cipro to treat C. diff. C. diff is often seen in patients who've had multiple long-term antibiotic therapy, AIDS, and patients on chemotherapy.